includes all of the positive specimens for that week that met the criteria to be able to be sequenced. So there weren't any more that we could have sequenced. We were already doing the maximum. And I believe I'll let Dr. Hirschhorn speak to MUSCs, but I think that they also are doing close to, if not all, of theirs. Dr. Hirschhorn?
Yes, you're correct. Thank you. We are currently sequencing all of our positives that meet sequencing criteria, the same as Dr. Traxler.
All right, thank both of you for that. And Forrest, do you have a question?
Yes, for Dr. Traxler, what do South Carolinians need to do as this variant emerges in the state? We know it's been discovered in North Carolina just recently. What's the best guidance from DHEC and from MUSC? That's for Dr. Hirschhorn as well.
Please, if you are not already fully vaccinated and you're 5 years old or over, please get fully vaccinated. And if you are fully vaccinated and it's been the appropriate amount of time, you're an adult or even 16 and over now, please get your booster shot. So getting fully vaccinated for everyone 5 and older in the state, and then getting your booster shot as soon as you're eligible are the most important things that people can do to protect themselves from Omicron. We know especially that getting your booster shot really, when you're due, really helps to increase your antibody levels and your protection against Omicron variant.
As far as MUSC goes, we agree 100% with the recommendations coming out of the CDC and our local DHEC.
And thanks again to both of you for that. Zach, do you have a question?
Yeah, thank you so much, Dr. Traxler and Hirschhorn. I was going to ask you with respect to booster shots, is that something that you guys are tracking? How many people have gotten boosters so far? I couldn't find it on the website, but I wasn't sure if that was something you guys have access to or will begin to provide publicly.
Sorry, now I'm the one struggling with the mute button or the unmute button, I should say. So we track third doses, and so those do include individuals who are immunocompromised and needed a third dose of the vaccine, but also boosters. And I would imagine the majority of them are probably boosters. That information is on our vaccination dashboard on the DHEC website under the administration view on that vaccination dashboard. And last I knew, we were up well over 500,000, maybe even over 600,000 at this point. It was increasing pretty steadily here, especially recently.
Thank you, Dr. Traxler. And Dana, do you have a question?
Do we know where the cases originated? Were they traveling, or did they have contact with someone who was traveling?
Dr. Hirschhorn, do you want to answer? Or do you want me to take that one?
I'll let you take that one since DHEC is fabulous in their contact tracing abilities.
So, it can be very difficult to determine where somebody got a case, whether it's the Omicron variant or Delta or any other case of COVID-19. We know of these three, there is a mixture of travel and not travel included in it. So the main point here is we know this variant is all over the country and the world. And so we really need to all take the same precautions, whether we are 10 minutes down the road from our house or whether we are across the state or across the country or halfway across the world. We need to be getting vaccinated, and when we're in public places, wearing our mask and trying to social distance, because the reality is it is pretty much widespread. Maybe not in terms of numbers, but in terms of geography at this point.
Thank you, Dr. Traxler. And Veronica, do you have a question?
Hey, this is Adam Mincer at WIS on Veronica's account. The main question is, can you tell us about the symptoms we're seeing amongst these three cases and also age ranges?
Do you want me to take that, Dr. Hirschhorn? Do you want me to take that, Dr. Hirschhorn, are you?
That's fine.
So all three are adults, do fit into our adult category. When we are looking at symptoms, all three have had symptoms, but they have all been mild symptoms.
When you say mild symptoms, just because I know that term is slightly confusing to some, can you explain a little bit? Is this just a normal kind of cough, sneeze? Can you break that down a little?
So when we say mild symptoms, we're talking about COVID-19. We're talking about things that, first of all, aren't going to make you feel like you need to go to the hospital and potentially be admitted. So things you're not experiencing significant shortness of breath, or significant chest pain, things like that could be truly scary in emergencies. We're typically talking more about a lot of times the flu-like symptoms, as you pointed out, cough, respiratory symptoms can be common with COVID-19, sometimes fever, but symptoms that you can take care, or those that you live with can help take care of you at home without needing that higher level of medical care that you would receive at a hospital.
Thank you, Dr. Traxler. And Brooke, I believe you're next.
Hi, can you all hear me? Okay, perfect. I was going to ask, are you able to say whether these 3 people were vaccinated or unvaccinated? And are you able to say specifically what counties they tested positive, whether that be Beaufort or Charleston?
So I'll take the vaccination question, and then I'll pass to Dr. Hirschhorn about the county. So all 3 individuals were fully vaccinated. But I do not believe any had received a booster. I'm not certain about their eligibility for booster in regards to timing. Dr. Hirschhorn, do you want to ask? She asked about the county.
Yeah, all of them were in Charleston County.
All right, thank both of you for that. And Simon, do you have a question?
Yeah, just a quick follow-up, because I know that we're doing the number possible for sequencing. I'm curious, are there enough South Carolinians taking COVID-19 tests to have an accurate picture? I know that we can't necessarily do the sequencing unless we know that there's an S gene dropout.
Well,
So,
actually,
yeah, Dr. Hirschhorn, you take this because you can speak to the sequencing more.
so with the sequencing, even if there is some S gene dropout, which usually refers to PCR or diagnostic testing, we are able to sequence the entire viral genome. So we'll be able to see all of the mutations that are present in Omicron. That's one of the advantages to doing whole genome sequencing, is that you do see all of the positions in the virus to be able to make that variant call.
I don't know
Dr.
if I.
Hirschhorn, are you all sequencing ones that do not look like they have the S gene dropout? That might be the other corollary question.
Yeah, so the test that we use does not target the S gene. So our assay actually would not detect S gene dropout specifically. And to sort of answer your question about the amount of sequencing, so there's a lot of epidemiological support to suggest that if you are doing at least 5% of the sequencing of your state, you'll be able to find novel variants or the new variants that arise. And I believe that South Carolina is doing a very nice job trying to capture those positives and reach that 5% goal.
And I believe that we are at, or if we are not beyond the 5%, we are certainly very close. I believe when you combine in the sequences that are being performed by labs outside of us, Dr. Hirschhorn, I believe, because as of last week, we were averaging just a few shy of 500 a week from other labs also.
Yeah, I think we are above that 5%. I know we are at MUSC, and I'm sure that you are as well, individually.
Yes, yes.
Thanks again to both of you for that.
But Simon, to your
Yeah,
sorry,
I might have
to
been a
answer
little
your
confusing.
question, Simon.
I pretty much, I'm so sorry. I might have been a little confusing. I pretty much just wanted to understand if more South Carolinians should be completing a COVID-19 test to get a better understanding of Omicron in the state.
I think that we are seeing good amounts of testing for the case, for the percent positivity that we are seeing. And as Dr. Hirschhorn pointed out, we are doing more than what's recommended for the sequencing. So I still encourage people, if they, are symptomatic or if they have reason to think they've been exposed and they are not fully vaccinated, to go and get tested.
Thank you, Dr. Traxler. And Forrest, do you have another question?
Yes, sir. You mentioned all three of these people have been fully vaccinated. What's the risk with people who have gotten most or all of their shots with this new variant? Is it different than Delta? Is it different than the original COVID strain? It's interesting that all three of them have been vaccinated in some sort.
Sure. So we are seeing the little bit of data and evidence that is out there, and understand that this is still very limited. A lot of it is coming from other parts of the world where Omicron was detected and spreading sooner. The little bit of evidence that there is and data does suggest that being fully vaccinated may not be as protective against Omicron as it was against Delta or other previous strains. However, that's where getting the booster is very important when you're due for your booster, because that booster has shown to increase it back up. The most recent data I saw for that was coming out from the NIH director, Dr. Francis Collins, and he said that 76% basically efficacy once you had your booster. So you're getting right back up, maybe not quite as high as it was against the Delta and others, but you're still getting very good protection once you get that booster.
And then just to follow that up, Dr. Traxler, what about the percentage of people in South Carolina who are vaccinated? I don't want to get into specifics of 1-shot, 2-shot booster, third dose, but who have gotten a shot. Do you know if those numbers are steadily climbing? Are they holding at a certain number? What's the status of that?
Sure. So we are seeing, in terms of just looking at vaccination rates among eligible people in the state, we are seeing what we've been seeing here for the last several months, which is a very slow increase. It is, we saw certainly the percentage go down when you added in all the 5 to 11-year-olds. That was actually a good thing because we were adding in the 5 to 11-year-olds. But when you break it out by age, then it's a very, very slow but steady increase. So I would certainly like to see a much faster increase in the percentage of vaccination.
Thank you, Dr. Traxler. And Emily, do you have another question?
Yes, I wanted to know, everyone's preparing to see family for the holidays. What is the best advice that you can give them, considering now that we have this new variant in the mix?
Certainly. So first of all, get vaccinated. If you have not begun your vaccination series, getting it now is not going to be in place in time, for example, for Christmas, but there are other holidays beyond Christmas that we're going to want to gather for, not to mention everyday life. So please get vaccinated. Everybody, when you're around groups of people that are outside of your own household, please, I encourage everyone to wear a mask when you're not eating or drinking if you're going to be in close contact and indoors. A lot of this are the same protective actions that we've talked about for almost 2 years now. Outdoors is better than indoors if the weather is good, and it often is in South Carolina, thankfully, in December. Try to spend some time outdoors or on porches. Increase the air exchange, the ventilation, if you are going to be indoors. Again, wearing that mask, doing the distancing, and then getting vaccinated, certainly, and getting boosted. And those are really going to be more, though, for the holidays and future after Christmas.
Thank you, Dr. Traxler. And Zaria, you're next. Do you have a question?
Yes, I don't know if you've already talked about this in the beginning, but Given the recent rise in cases, do they indicate another surge of COVID-19 cases in the state?
So I think that the little bit that we have seen is really just too early to say. You know, when we're looking at bigger categories, more like at the weekly cases, we're seeing slight increases, but it is certainly not the increase that the rate of increase that we saw last year. We have gotten to this point in the holiday season doing much better than we did, like I said, at this time last year. However, we are not out of the woods, and so it's not a reason for people to let their guards down. I think we all still, especially in light of Omicron, just the emergence of it worldwide, nationwide, and now we know it's confirmed, you know, that to be in our state is why we all need to just, you know, stay the course with these protective actions, especially to get through the holiday season without seeing any significant increases.
Thank you, Dr. Traxler. And Dana, did you have another question?
Omicron is still relatively new. Part of it is we're not quite sure how aggressive, and we're not quite sure how virulent. Is it Delta-like that hates everybody, or is it we don't like you, but we're not going to kill you? We don't know. Is that unknown a big part of the concern?
The concern, a lot of it, yes, is multifactorial, but a lot of it does go to the unknowns. Looking at several factors then, how severe of illness it causes, which we know can certainly have an impact when it comes to our hospitals and their capacities, how quickly and easily it's spread, and then how effective the vaccines are at preventing especially serious illness or death, and how effective treatments are, like monoclonal antibodies that have been shown to be quite effective against other strains of COVID-19. And of course, then with oral antivirals on the horizon, you know, whether those their effect is impacted or not. So it is going to be a function of those different unknown factors and what the answer is for each of those combined.
Thank you, Dr. Traxler. And Zach, do you have another question?
Yeah, thank you. And this sort of piggybacks on something you were just talking about with respect to a potential surge. I was just wondering, with the identification of Omicron in South Carolina, is DHEC anticipating there being a surge, more likely to be a surge than maybe there previously had been before it had been identified? And if so, what sort of preparations is the agency making?
So I don't know that this makes us feel like we are much more likely to see a surge. I think that we have been preparing for quite some time that the winter could see increases and potentially a surge. And so it's we have been doing a lot of work through you all, which I greatly appreciate y'all's help, you know, communicating to the public that this was a real concern, seeing a surge, and the mechanisms that we could do to prevent it, mainly vaccination. And thankfully, we have not seen, you know, as bad of an increase or surge as we did last year in terms of this time of year. Looking at what Omicron has done in other places, like in the United Kingdom, and even in some states here where it was identified sooner, we certainly could see a significant increase in cases due to it. But regardless of whether the increase in cases was due to unvaccinated people who aren't masked, you know, spreading Delta around, or spreading, you know, or people spreading Omicron around, I mean, our concern has still been the same thing, and that's to prevent serious illness and death.
Thank you, Dr. Traxler. And Brooke, did you have another question?
No, is my hand raised? Oh, I'm sorry. I forgot to lower it. My apologies.
No worries, no worries. Forrest, did you have another question? Forrest, do you have a question? All right, and if you do, just let us know. And Dana, did you have another question?
Oh, come on, Dr. T knows I almost always have another question. Are you continuing to work closely with the Department of Education, and have you apprised them of this latest development?
We are absolutely still continuing to work very closely with Department of Education. I have not spoken to them in the last few hours personally, but I imagine that our schools coordinator has, as we have others beyond myself that work very, very closely with them and with many of the school districts.
And Simon, did you have another question?
Yes, on the same topic of children, I know that children hospital leaders have said in the past that a surge in COVID-19 cases has been followed by a surge in MIS-C cases. And I know I saw in DHEC's dashboard this morning, September's the last month that's complete with data, and it shows the record for the highest number of MIS-C cases recorded in 1 month. I'm just curious if you have a message for parents ahead of the holiday season, when kids are off of school before we go back in January, just considering what is at risk.
Certainly, and that is that these vaccines are very safe and very effective for children as well. And as you point out, children especially are not out of the woods once they get past that acute illness. Many times children will have less severe illness with COVID-19 early on in that acute phase. But there is that phenomenon, that condition or syndrome, that multi-inflammatory and multi-system inflammatory. I can't even speak now, y'all. The MIS-C, and so that is something then that you do have to worry about. And then there still is potential for long COVID in children, like there is in adults, and so. Getting past that acute phase in that first 10 days is not the only hurdle, if a child were to get infected with COVID-19 potentially. And so when there is a safe and effective vaccine that's authorized for all the way down to age 5, so for all school-age children, especially if you know they're going to be spending a lot of time in close contact together over the holiday break, and then, of course, going back to school in the winter months, I really encourage parents to protect their child and get them vaccinated.
Thank you, Dr. Traxler. And Dana, do you have a question?
Multi-system inflammatory syndrome of children. Sorry, I could not get that out a minute ago.
I had faith in you, Dr. T.
Thanks.
Okay, this is more just housekeeping. Given this development, would DHEC possibly consider, on how things go over the next 7 days, would DHEC consider maybe doing a briefing next Wednesday?
I don't think anything is ever really off the table when it comes to communication and us. We determine when we're going to do briefings based on when there's need, and that's driven by when there's new information that's important and critical to get out to the public. So I don't think we're planning on one at this time, but I will not say absolutely not.
And given this new information, Dana, we'll definitely keep you guys in the loop on if we will have one next week.
Yeah, because I'm thinking we got lucky that there was one scheduled for today.
And so, yeah, and Zach, do you have another question?
I do, thank you. Yeah, I was just going to ask, I know you've already spoken about some of the precautions that, we've already been told to take for the last couple of years, but I'm wondering, given Omicron's propensity to evade vaccines or natural immunity, are there any additional precautions that people should take, vaccinated people or even people who have received boosters should take that maybe previously weren't necessary?
Certainly. So for fully vaccinated people, the message is if you're eligible and you haven't gotten it, get your booster now. Because that is one thing that we do have a little bit of evidence already, a little bit of data to say is helpful. Certainly people who are fully vaccinated and even boosted, considering Omicron, may consider if they want to wear a mask when they're going to be around a group of people. A lot of that comes down to their individual assessment of their own risk, if they were to get sick, or what the risk is of the people they live with, the setting that they're going to be in, how high risk it is, and so forth. So that's really an individual decision, but I wouldn't fault anyone if they wanted to wear a mask on as an extra layer of protection on top of their vaccination and booster.
Thank you, Dr. Traxler. I'm not seeing any more hands. Are there any more questions for Dr. Traxler or Dr. Hirschhorn? All right, and Emily?
Yeah, I heard Zach mention earlier natural immunity. Do we know, I know it's early, is there any indication of how Omicron interacts with natural immunity?
There's some very early data, even earlier than there is, I'd say even less than there is for vaccines, but that does suggest that potentially natural immunity is not as protective against Omicron as it was against Delta and other variants. So kind of similar to that pattern that's being seen with vaccines. So again, all the more reason we know that the people with the best protection against COVID-19 in general are those who have natural immunity, but also are fully vaccinated and, when appropriate, boosted. And so those are the folks then that are going to be the most likely to have the most significant protection against Omicron. So I would encourage people not to count on their natural immunity alone.
Thank you, Dr. Traxler. Do we have any more questions? All right, well, seeing no more hands, we appreciate you as always for joining, and thank you, Dr. Traxler, and you, Dr. Hirschhorn, for making yourselves available. We will keep you posted on our next media briefing, but until then, everyone have a great day and stay safe.